Are your patients sober, but still struggling? Hi, I'm Dr. Arwen Podesta, functional integrative psychiatrist, triple boarded in adult psychiatry, addiction medicine, and forensic psychiatry. I help addiction professionals improve patient engagement and recovery outcomes using integrative, evidence-based strategies. In this video, I'm sharing the tools that make that possible. We're going to cover hidden signals your current protocols might be missing and how to evolve them using evidence-based integrative tools that actually increase recovery rates. Many clinicians still rely on one-size-fits-all planning, which can limit treatment, and we end up missing some of the real barriers to recovery. So your patient might be showing up. They're checking the boxes, they're technically sober, but what's under the surface, they might be stuck. They're tense, restless, discontent, flat, just kind of going through the motions, far from thriving. And the worst part is they often blame themselves because the protocol says they are doing it right, so why don't they physically and mentally feel better? This is where well-meaning conventional protocols and guidelines can quietly backfire because a one-size-fits-all plan really limits treatment to abstinence and talk therapy. And when patients start kind of white-knuckling it through their sobriety, they're maybe technically recovered from the substance itself, but it doesn't feel like healing. And when that inner tension builds without release, without support, without understanding, relapse is much more likely. Not because the person failed, the system did. This is the gap. This is the moment we, as providers, need to intervene. Because staying stuck isn't a failure of willpower. It's a signal that something deeper needs attention. And if we don't recognize that signal, we risk reinforcing the very cycles the patient came to us to break. Over the years, I've worked with patients who had spent years in sobriety through 12-step. They followed the steps, they stayed abstinent, they did everything right, but they described their recovery as white-knuckling it. Yes, they were sober, but they were empty, discontent, disconnected. And once the substance use stopped and the chaos settled, the deeper stressors came into fuller view, such as financial fears, emotional pain, family trauma, all of it coming up without the buffer of the substances to mute it, which is maybe why they were using in the first place. The stressors become more evident and people often get overwhelmed, decreasing mental stability, decreasing dopamine tone, and predisposing to relapse. In other words, once the external fire is out, the internal imbalances are fully exposed. And if those underlying neurochemical and emotional issues aren't addressed, the person doesn't really feel safe in their own body and mind. And that's certainly not recovery. That maybe is surviving, I suppose. It's abstinence, but it's not thriving. And it's exactly where so many patients stay stuck, despite doing everything they're supposed to be. So what is actually going on here? Why do so many patients look compliant or adherent on paper, yet feel completely disconnected or depleted in reality? And why do so many clinicians, despite our training, our structure, and our truly best intentions, we often miss the moment when recovery quietly stalls? And it's not because we're not trying hard enough either. It's the system we've inherited just wasn't designed to go deep enough. Traditional protocols were built around crisis stabilization and behavioral change. Yes, those things absolutely matter, but they're just a starting point, not the full journey. When we stop at surface level, we unintentionally leave root causes out. And that's our blind spot. It can also be an opportunity, and when we really understand what's missing and to start filling in those gaps, we don't just help patients stay sober, we help them rebuild the full foundation for lasting recovery. So let's look at what's actually keeping these patients stuck and why integrative strategies can help them move forward when standard care stalls. First, conventional treatment often overlooks underlying biology. Talk therapy, it's great. Group therapy, excellent. Accountability systems, those are all powerful tools, but they don't really rebalance neurotransmitters in and of themselves. They don't heal the gut-brain axis. They don't regulate cortisol, decrease inflammation, restore circadian rhythms. Yet, these are the exact systems that shape our patients' cravings, mood, impulse control, resilience, really. So when a patient is depleted physically, nutritionally, hormonally, neurologically, and we only offer psychological tools, we're kind of asking them to climb a mountain without the right gear. It's kind of like asking them to think out of their seizure. It doesn't work. So that brings us to the second reason patients get stuck: one-size-fits-all planning. There's a term you've probably heard, the cookie cutter approach. Well, that approach, the cookie cutter approach, it ignores personal biology. It ignores individual trauma history. It ignores micronutrient deficiencies, ignores lifestyle needs, etc. It's true, too many programs are still built around generic step-based models with little room for nuance. But recovery isn't a single path. Every person is different. It's a puzzle that looks different for everyone. And if we ignore that unique, individualized piece, we end up prescribing strategies that just don't stick for long-term wellness. And finally, we've got to talk about the metrics we use to define success. Many people in abstinence-based recovery are adamant that anything less than abstinence is not recovery or is not success. But what is success? If our metrics are outdated, we can accidentally keep patients trapped in a cycle of compliance without transformation. And that's why integrative strategies are so powerful. They expand what's possible, not just symptom reduction, but full system healing. When we address neurobiology, we individualize patients' plans. And when we redefine success based on the patient's own personal life goals, that's when the deeper recovery work can truly begin. So now the question, what do we do with this? How do you, as the clinician, actually work with these gaps without throwing out everything you've built, without restructuring everything? You don't need to scrap your entire program or abandon the tools you already have that are serving your patients. You just need a more complete framework, one that honors what's working and makes room for what's missing. And that starts by asking different questions. Instead of how do I get this patient to comply with the protocol, we want to start with us. Where is our protocol failing to meet the patient? So let's walk through how you can begin applying this in your own clinical work. Before we dive in, if this is resonating with you, and if you want to go deeper into strategies we don't usually learn in standard training, go have a look at my manuscript, Hooked. There, I go into a lot more detail and tackle the biggest questions clinicians have about addiction therapy. You can find the link in the description. Now let's get back. First, I want you to start by taking an honest look at your current protocols, not from judgment, but really with a curious mind. Ask yourself, are there places where patients tend to stall? Do certain patterns keep showing up, no matter how adherent they are? What you're looking for is signals, those quiet clues that may be out of sync with the person. For example, do you have patients who are technically abstinent but still anxious, irritable, emotionally flat, have cravings, have sleep problems? Are there treatment plans that assume one size fits all will work, even though that kind of varies widely? Do we discuss sleep with them other than basic, like, did you sleep? How many hours are you getting? These aren't minor oversights. These are foundational gaps. Recognizing them is really the first step to closing in on them. Next, begin to reframe your definition of success, not just for your patients, but for yourself. Instead of anchoring outcomes solely to sobriety or compliance, let's look at stability. Let's look at engagement. Look at regulation, connection, resilience. If a patient's no longer using their substance or substances, but still waking up exhausted, still not being able to go to work, still cycling through panic, isolating from support, cravings or not, there's tons more work to do. Not because they failed, the foundation still needs reinforcement. Third, begin weaving integrative foundations into your treatment model bit by bit. Start simple. Start with what you already have access to. That might mean bringing in nutritional consults, even just once a month, or making space in a session to explore a patient's hygiene or gut health, or even daily movement and exercise. Remember, you don't need to do it all at once, and you would overwhelm the patient if you tried to get them to do it all at once. But integration is not about complexity, it's about completion. Every small shift you make in your protocol opens the door for deeper, more durable recovery. So as you start seeing these patterns, the patients who do everything right but still feel off, the treatment plans that looked good on paper but don't really hold up in real life, the symptoms that keep returning even when the substance is long gone, I want you to pause and ask, what if this isn't resistance, but it's residue? The residue of unresolved biology, the residue of protocols that stop at sobriety instead of aiming for full spectrum healing. Not about blaming providers or the patients, or even discarding what does work. It's about finally building up what's been missing. And the truth is, once you learn to spot these, you can start transforming them pretty easily, not just for one patient, but across your entire approach to care. Standard care often stops at basic stabilization, but true recovery requires something more. And when you bring integrative tools with intention, even one small change can ripple through a patient's entire system. And that's where healing really begins to take hold. So if you're ready to evolve your approach and make your protocols work with your patients, not against them, the next step is clear. Let's go watch my next video where I'm going to break down the integrative models we're using to move beyond outdated methods and what it looks like in practice. Thanks for watching, and thanks for the work you do.